Babies don't come with instructions. That may leave a lot of new parents wondering, okay, what do I do now? And wishing there was a class to help fill in the gaps. As Doug Johnson explains, it turns out there is a class for new parents.
There's a question and you think you might need to come on.
Sitting in a meeting room may not be what most folks want to do with their Saturday morning. For this group meeting at Baptist Women's Hospital, they're learning things that will help people who aren't here because they haven't been born yet. Expectant parent classes are designed to help prepare first-time moms and dads for parenthood.
Well, we prepare them to go home with the baby. We want to make sure that their home is ready and that they're emotionally ready and they know what to expect. And so if they have all that information, then they're less anxious and they're looking forward to the experience instead of worried.
Childbirth educator Christy Davis says new parents have a lot of questions they want answered before babies arrive. How to set up a nursery, how to travel safely with a baby, what to do if a baby is sick or if there's an emergency, as well as the everyday details of feeding and dealing with other physical needs.
There's a lot of information that first-time parents need before heading home as a family. The Expectant Parents class can fill in a lot of those gaps.
They love to be up on your shoulder like this. You guys.
Parents-to-be learn how to hold and carry babies, as well as when to call a doctor. Davis says it's never wrong for a concerned parent to call a pediatrician when they have a question about their baby's health status. The nurses conducting the class also cover what to do when baby cries.
We talk about how to cope with crying, and a lot of people are very surprised about how much crying a newborn actually does for the first 3 months. And so we talk about coping strategies and how to tell if something's wrong versus if just a need needs to be met.
There's even the chance for dads-to-be to get an idea of what new moms are going through.
This is about a 7 months, I'd say.
In each class, one of the guys puts on a suit that simulates the size and weight of a pregnant woman so he can experience, if only for a few minutes, what she has to deal with for months.
Is it heavier than you thought?
The new class also offers advice about advice. New parents will get child-raising tips from family and friends. Davis says sometimes that advice will be good, but sometimes it won't be. So new parents should always defer to their pediatricians. For Smart Medicine, I'm Doug Johnson.